Mm, Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. K. Raja Subbareddy from Apollo Cradle and Children's Hospital. He is going to talk about common neonatal and infantile concerns. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Yeah, thank you. Good afternoon, everyone. This is Dr. Subbareddy, consultant neonatologist and Apollo Cradle, Jubilee Hills. Okay. Today we'll discuss about the common neonatal and infantile concerns because in the day-to-day practice we face lot of questions from the parents, especially the mothers who are with their first baby. They have a lot of apprehensions and doubts regarding their baby. So to address them in this session, I'll try to address most of the most common issues. Okay. Uh, Coming to the first concern will start right away from the delivery time. Neonate is the baby who is 1 month old. Before 1 month of age, we call the baby as neonate, and before 1 year of age, we call that baby as an infant. So the coming to the problems or concerns, they will start right away from the immediately after the baby delivery, like regarding the feeding, like what feed I should give, how much quantity I should give, and how will I know that the feeding is adequate for the baby. So coming to the feeding, it is always good for the baby to give breastfeeding or mother's expressed breast milk, because the mother milk will suit the baby needs, and compared to the formula feeding, the bloating and vomitings or feed intolerance will be less with the mother's feed. So it is always good to give exclusive breastfeeding or expressed breast milk for the baby. If maternal secretions are less, or if the baby is having hunger or crying too much, then we can give the formula feeds. Always the first preference is to give the mother feed only, breastfeed. Okay. Other thing is, how will I know that my feeding is adequate for the baby? If the baby is comfortably sleeping in the first month for 2 hours at least after giving a feed, and passing urine at least 5 to 6 times in a day, and gaining weight consistently after the first week, then we can tell that the feeding is adequate for the baby. So if inadequate, obviously the baby will cry, and weight gain won't be there. So feeding adequacy will come to know from the baby activity and feed demand only. Okay. Feeding cues are the things like baby sucking the fingers or sucking on the lips. All these are feeding cues. So feeding cues indicate that baby is expecting the feed from the mother. So we should start the feed if the baby is having feeding cues. At least in a day, in the first month, at least minimum 10 to 12 feeds we need to give for the baby. Okay. Not just the number of times, adequacy also we should see. If you are giving the mother feed, you have to give at least 15 to 20 minutes on one side of the breast, then switch to other breast. If you are giving only on one side for 5 10 minutes, then switching to other breast in 5 10 minutes, the baby will get only the fore milk, which will satisfy only the thirst of the baby. So the hunger won't be satisfied. As a result, the baby will start crying intermittently and immediately within 2 hours. So again, in 1 hour they will expect the feed, or so this is inadequate feeding. And other problem with this feeding only 5 10 minutes on the fore milk colonies, the babies can have greenish stools because of lack of nutrients and fat content in the milk what the baby is taking. Only fore milk baby is getting. So the stool can turn into green color, which will make the parents again apprehensive. My baby is always passing green color stools, they will ask. Okay, this is coming to the feeding. So preference is for the breastfeeding only. Either give directly, or if the mother has any nipple or breast issues, she can express and give. So preference is for the breastfeeding, and no pre-lactal feed should be given. Means either sugar water or honey or any other form of liquids should not be given to the baby other than the feeding. So this is regarding the feeding. Coming to the after feeding, the next thing is my baby is vomiting or spitting some amount of milk while feeding or immediately after the feeding. This is also normal. We call this as reflex, gastroesophageal reflex, which is common in the newborn babies. Even if the mother is having mother is not, or the baby is not properly burped after the feeding, sometimes the baby can regurgitate the like swallowed milk. So this is also normal. When we have to worry about this reflex or vomiting is the number of, and what we should do when the baby is having vomiting. These two things I will address. When the baby is having vomiting or vomiting, that time you need to immediately lift the baby, keep the baby over your shoulder, and burp the baby or turn the baby to one side so that the baby won't aspirate the milk content. That is one thing. And if it is happening recurrently and persisting beyond 1 month, or it is affecting the baby and baby is having too much of arching back, not gaining weight, then we have to treat the reflex. So okay. For that, the doctor will prescribe the medication, and positional changes also they will suggest. Generally, intermittent reflex problem can be there with the babies up to 6 months. When we start the semi-solid food in the weaning time, that can solve the problem. Okay. So when to consult the doctor is the baby is not gaining weight, or it is affecting the, after every feed it is happening and affecting the baby's weight gain, and sleep also it is affecting. Because of this, baby will be irritated. Most of the time baby will be irritable and cry too much if the baby is having too much reflex. Okay. And curd like vomiting is generally normal. So if the baby is having the curd like vomitings, no need to worry. Okay. Even sometimes the baby can have stools also, like white color stools. Occasional this thing is normal only. Okay. Other important thing concern is maintaining the temperature, means normal temperature of the baby. So the expected temperature range or normothermia in the baby is maintaining the temperature between 36.5 to 37.5. Okay. Hypothermia is cold stress is between 36 and 36.5 degrees centigrade. If the baby is having the temperature, that is called cold stress. So more than this, the during the winter and during the summer, these are the extremes the baby can have. In the winter, hypothermia; in the summer, hyperthermia and dehydration. So how to take care of this? Main temperature maintenance in the newborn period is very much important, especially in the first month. You need to wrap the baby properly, and clothing should be comfortable. And intermittently, you need to touch the baby and see whether the baby is cold or warm. Okay. The baby, you feel the baby is very cold, you need to wrap the baby more, put the cap, gloves, socks, and frequently check the temperature also. Okay. Hyperthermia means if you have done over wrapping, or because of the improper feeding or poor feeding, or because of the environment, like in summer the baby is getting temperature, then the baby's temperature is above 37 degrees centigrade, then that is called hyperthermia. So what we should do when the baby, or in the Fahrenheit, if you want to know, if it is 100 and above, that is called hyperthermia or fever. So we need to unwrap the baby and reset the temperature after half an hour. So if the temperature has come to normal, this is purely either environmental or because of overwrapping. If it is persisting above 100 and the baby is also poor, not taking feed, poor in activity, and not taking feed, then that is can be because of infection. So you need to consult the doctor. Okay. This is regarding the temperature maintenance. So other common concerns which will start from the day 2 and will be there for 2-3 weeks is neonatal jaundice. So the jaundice in the newborn period is not same as jaundice in the adults or pediatric patients. So this can be physiological and normal for the babies to have jaundice because of liver immaturity and many other causes. Poor feeding, weight loss, all these can add. Other than this, some abnormal like pathological reasons like blood group mismatching and other G6PD deficient, like some major other problems also, the other reasons also there for the jaundice. So when to worry, when to consult the doctor, when to take the treatment, we'll discuss. Like if the jaundice, if the baby is looking very much yellow, lemon yellow, and baby is dull, not taking feed, this can be because of high jaundice causing the baby encephalopathy, means dull in activity. Then you have to worry. Okay. Otherwise, mild like bluish, like yellowish discoloration of the eyes and yellowish discoloration of the palms and soles or skin is expected to be there in the baby. Okay. So when you go to the doctor, doctor will clinically assess the baby and he will check the jaundice either in the skin or the blood based on what is his interpretation. So when we have a nomograms, normal cutoff ranges for each day for a particular gestation, and the weight and like other risk factors are there for the jaundice. So based on that, we decide the cutoff value, whether to treat the baby, and hours of life also, on what day we have done the jaundice test. So based on this, we will decide whether to treat the baby or to wait and watch, or whether to come for a review 2 3 days later to reassess the jaundice, when to come review. So based on this, we will tell when to review. Okay, and when to worry if the jaundice level in the blood is going beyond 20, or if the baby is having any jaundice related symptoms like fits or encephalopathy, poor feeding, arching, all this, then you need to worry. So generally, most of the hospital nowadays, or in the Apollo Cradle, we are regularly monitoring jaundice in the skin, and routinely we check in the blood along with the other screening measures. So we don't allow the jaundice to rise very high. Before that itself, we do the intervention. So jaundice or yellowish discoloration of the eyes always need not be treated. It can naturally come down when the baby is having good amount of feeding in the motion and urine. So proper feeding is the main important thing. So other concern is whether my baby needs any supplements or any vitamins. If the baby requires any vitamins or supplements, some parents will ask. As per the IAB recommendations, only vitamin D is recommended to be given till 1 year of age, 400 IU for a term baby. If it is preterm, 800 IU we give. Other than that, no need of giving multivitamin drops also. The babies are low birth weight or born as IUCR or late preterm, then we can add multivitamin drops. Other than these two, no need of giving any other supplements routinely. Okay. Coming to the other common skin concern, skin rashes or coming in between and going. This is the most worrying thing sometimes for the parents, especially erythema. There are types of skin rashes which you need to worry or no need to worry. Okay. There are some benign skin rashes which will naturally come and go with the time. We just wait and watch on that. Even the doctor won't prescribe any treatment. Like there are like erythema toxicum is a skin condition where there will be lesions, skin lesions with red background on the skin, with like looks like pustules. Okay, they naturally go away in 1 week's time, so no need to do anything. Neonatal pustular melanosis is another skin condition where the baby can have a healed skin scars, which will not cause any problem for the baby. Okay, these are benign skin lesions which you need not worry. Other skin rashes are like something like diaper rash or fungal infections below the neck. All these are, it's because of constant wetness they can come. If they are there, better to consult the doctor. How bad they are, the doctor will assess, and if required, they will start the treatment, topical ointments. Okay, and whether the parents other query will be like whether they can give oil massage to the baby, and whether they can use the cosmetics, and when to do the bathing. So oil massage, gentle oil massage, we can do just to improve the circulation and keep the baby comfortable. With olive oil or any oil, coconut oil or any oil is fine, but we should not use the mustard oil for the massage. Even for the head also, like whether they can apply oil in us. Not we should not apply too much of oil over the forehead while giving bath. It will make sticky this thing, and that baby can have aspiration pneumonia. So small amount of oil can be applied over the forehead also. Coming to the bathing, when to give the bathing, scrubbing is fine till the umbilical cord dry and fell off. Later we can give the regular bathing. Or if you are comfortable and you have experience in giving bathing, you can give the regular bathing from the day 3 itself. If the baby is fine, feeding well, you can start the bathing also. And immediately drying the baby after the bathing, keeping the baby warm is the important thing we have to follow. And regarding the cosmetics, generally till the first follow, better to avoid the cosmetics. Powder we suggest not to use in the first month at least. Later, bathing like baby bathing soap and shampoo and moisturizer can be used, but the ones with the less smell, like less fragrance, advisable to use the cosmetics with less fragrance. And never apply kajal over the eyes, it can attract the eye infection. So strictly no to kajal for the eyes. Okay. Regarding the umbilical cord care, umbilicus is the one which will have jelly-like tissue when we clamp the cord after a few days, like in 1 2 weeks. If it is not detached even after 2 weeks, you need to visit the doctor. Umbilical cord care is one of the important thing. There can be sometimes watery discharge from the umbilicus, which is normal. Even bleeding because of diaper trauma or the baby herself, baby itself, injuring because of the movement, excessive movement, or the hand can happen. So if it is too much bleeding, we have to see whether it is happened because of trauma or anything. To control, we have to clean that. If it is excessively bleeding, we can apply betadine ointment. We always have to rule out whether there is underlying infection. Okay. And bleeding problems also we suspect if it is unusually bleeding or large quantity bleeding. Okay. Regular bleeding is fine, it can happen sometimes when the baby is having trauma to the umbilical cord site. And infection is the one, umbilitis, which can cause concern for the parent. It can be like there is erythema around the umbilicus or purulent discharge, means pus like discharge from the umbilicus. That is called umbilitis. So this will be treated with the antibiotics only, topical antibiotics if required, oral antibiotics also, based on the baby condition. Okay. Uh, and umbilical granuloma is another concern. It is neither the umbilicus won't continue heal properly. Constantly there will be some redness or the discharge intermittently coming from the umbilicus, which can be treated even with the common rock salt at home, or you visit the doctor, he will prescribe what to do, like using alcohol swabs to clean and review. Okay. And other concerns, especially in the female newborn babies, are sometimes there can be white discharge, like discharge from the vagina in the female babies, which is common. We do not it is not like something happen in the adult. This is not infection. This is natural secretions that can come, and there can be sometimes even the bloody vaginal discharge that can happen because of withdrawal of hormones from the mother, especially in the girl babies. This is also nothing to worry. If it is excessively happening or continuously happening, not settling in 1 2 days, then you need to visit the doctor. Okay. Other thing is doing breast massage in the babies. This is also not recommended because you can cause hematoma or trauma to the developing breast these tissues. So don't do breast massage or too much handling of the breast if not. Okay. And coming to other general concerns in the newborn baby, cradle cap is the one concern the parents ask. This can happen because of sebaceous gland secretions in the head or scalp. So this is common in the baby. Sometimes it can last up to 6 months or 1 year also. So what measures to do is we need to do gentle oil massage followed by using a shampoo to rinse the head and gently remove the follicles or scales anything is there while giving with the shampoo, and you can do the combing also. Later you can give the bathing. So you need to do regular bathing, and if scales are there you need to remove them with the soft brush or uh, you can use comb also, soft brush or comb to remove the follicles. This will naturally will settle. Okay. And other concern is watering from the eyes in the newborn period or neonatal period. It is common to have occasional or intermittent watering from the eyes. The most of the times it will settle with the gentle massage over the inner canthus of the eye from above down. Okay. When to concern about the eye discharge, or this thing is when there is redness or swelling of the eye and the watering is huge and baby is unable to open the eyes, then we need to concern and we need to look for the any infection is there in the eyes. And other thing is ear discharge. The ear discharge in the newborn period most of the times because of faulty feeding or taboos. Means faulty feeding is if you are not keeping the baby proper position while feeding, especially head should be in the position up, if the head is kept down or mother is feeding lying down next to the baby, this sometimes can make the feed to enter into the gestation tube, and it can cause the middle ear infection, which will further cause ASOM, like purulent discharge from the eye, from the ear. Okay, that is can be one reason. And other thing is, if you are putting any oil or any water while giving bath, this will can attract the infection in the ear, so that will lead to the ear discharge, which is pus like ear discharge. So we need to avoid putting any drops in the ear. Okay, uh, we need to keep the ear dry even after bathing or while bathing also. Water should not enter the ears. It can attract the fungal infections and other bacterial infections, as a result ear discharge. And other common concern is noisy breathing. Noisy breathing, the nostrils or the nostrils in the newborn baby will be very narrow compared to the adults. So when there is minimal block also because of the regurgitation of the feeds, or naturally also when there are some nasal secretions blocking the nose, even minimal blocking can make the baby to have too much of noisy breathing. Further noisy breathing and occasional sneezing, it is not cold in the baby. Only nasal drops are enough. We can give the saline nasal drops frequently to, especially before the feed, to clear this blockage. Okay. Other concern is oral thrush, means white color patch over the tongue. This is one concern the parents will have. This can be normal white patch over the tongue, which will get easily, which will come away with easily when the mother is wiping the cleaning the tongue. Other these oral thrush because of candida fungal infection. For this we need ointment like antifungal cream will give. So you have a doubt regarding the like oral thrush, better to bring the baby to the doctor. Okay, so that if required, we'll start the medication. And other common and major concern is excessive crying, and whether the baby is having gastric problem or infantile colic. This is the common thing parents will ask. Babies excessive, when to call excessive crying, it is always debatable. If the baby is pink, active, crying, always think about the hunger. The hunger is not satisfied, baby will cry. That is the only way of a baby's communication. So we should address the hunger. So offer the feed. Other than the like hunger, other causes can be wet diapers or sensation of passing urine and motion. This also make the baby uncomfortable and they cry. And most of the babies will strain, means they raise their abdominal pressure to pass the urine and motion. This is also normal, so we did not worry about this. If the baby is, even after taking consoling or taking into your hands, the baby is crying and color of the baby is changing, and if you have concern, then bring the baby. And time duration when to call excessive cry is always debatable. Even after baby is not taking the feed, even after 30 minutes of the baby is crying, not at all consolable, then better to bring. Okay. And infantile colic is one of the cause. Exact etiology not known why the baby will have infantile colic. Other proposed things are disturbed maternal and baby's bonding is one of the reason for the infantile colic, especially in the evening times the babies will cry excessively. Whether any drops will help for this, answer is no. Most of the things are like placebo only. And we should not give or known like it can be harmful also, giving gripe water and all. Better avoid giving to the newborn baby or infant also. Okay. The contents of gripe water can be sometimes cause problem to the baby, so better avoid the gripe water and all. Okay. And other thing is, especially in the neonatal period, in between 7 to 10 days, the parents will tell my baby is having loose motion. Some Most of the time these are transitional stools, which will happen when the baby is on especially mother feed. Because of the change in maternal feed constraints, especially between 7 and 10 days, the motion color will change from yellow to the green to the yellow, and the baby can have little watery stools which will naturally settle. If the number is too much, not settling in 3 days, baby is getting dehydrated, then you need to visit the doctor. Otherwise, naturally it will settle. Sometimes there will be positional CTEV, means in turning of the foot. that can be there because of the positional. Okay, your doctor will see that, and if required, he will suggest the regular exercises. When to consult the orthopedician is if it is anatomical or skeletal, means bony deformity causing the CTAB, and with the maneuvers also it is not getting improved. Then you need to visit the doctor like orthopedician. Okay, coming to the vaccinations, like main concern is but vaccine is same, it will be given before discharge from the hospital. After that the vaccine will be around 6 weeks, 10 weeks, 14 weeks. Two things the parents will ask is whether to go for the painless one or painful one. The efficacy wise both are same, more or less, and the comfortable like discomfort and fever will be less with the painless ones. Okay, and it is up to the parents to go for which vaccine. Okay, and regarding the optional vaccines, you want to give best to your baby, try to give the optional vaccines also, because of city population, pollution, and going to the school, the other kids having the cough cold will make the baby susceptible for the flus and all. So flu, typhoid, all these are not no more optional now, it is mandatory, so better to get the full vaccinations. Okay, and the incidence of developmental disorder or behavioral disorders chance is very less. There are some misconceptions about the vaccine that this make the baby to become have some behavioral. All those are very less incidence and no association also, no proven associations. Okay, concerns about the growth and development. When your newborn baby, a 1 month old baby is growing, when you are growing for the vaccination, your pediatrician anyway will assess the baby's growth and development. If it is very delayed, like based on the baby's milestones, they will tell you whether it is delayed or not. It has to be properly followed only, then only we can tell address about the development. Basic milestones, like age, tentative age will be provided to you. Based on that, if you feel any delay, you need to bring the baby to the doctor. Okay, concerns about the growth. Generally, we expect the baby to grow head circumference to grow 2 centimeters per month in the first 3 months, then 1 centimeter in the next 3 months. And regarding the length, the baby will grow 1 inch in the first 6 months and half inch in the next 6 months. Okay, this is regarding the length and head circumference. Weight gain generally by first vaccination, if he gains 1 kg, that is fine. Okay, further vaccination, like the growth amount of weight gain and all will be little less compared to the first month. Okay, by 5 months if the baby's weight is double, and by 9 months to 1 year if it is triple, that is normal growth pattern. And the other common thing is transition from when how many days to feed the baby breastfeeding. Recommendation is to do the exclusive breastfeeding till 6 months. Okay, if not possible, little early, means 2 3 weeks or 1 month maximum early, but this comes with a little risk of having vomitings and loose stools. So weaning food, you can start around suggestion is after completion of 6 months you can start the weaning food. Okay, what to give in the weaning food? So you can start you can start any food whatever you are offering after 6 months. You need to give it like semi-solid food, semi-solid form you need to give, and you need to introduce the water also when you are starting the weaning food. Otherwise the child get constipated, and it will make the baby uncomfortable also. Okay, so you have to introduce one fruit, one vegetable, along with the water and some semi-solid ready-made food, or you can prepare at home. Okay, fruits also, you can introduce apple. Each month you can introduce one new fruit, one new vegetable. You can make it like khichdi. Vegetables you can mix in the, like prepare it like khichdi, and you can offer the baby. How frequently to feed? Babies will expect some food every 2 to 3 hours once. So offer something. If the child is eating, it is fine. If is not eating, again introduce. And they should not feel monotony also. So every month you need to change the fruits and vegetables. Okay, what all fruits you can give is you can give banana, apple, watermelon. In the vegetables, sweet potato, carrot. You can introduce peeling them and boiling them, mashing and giving them is suitable form in the initial weaning period. Later you can introduce, after 9 months completion, you can introduce the egg yellow. Like 10, 11 months you can introduce the non-veg soups also, based on the baby's digestion. So what to expect, like if the baby is tolerating well the weaning food, you can increase the quantity slowly. If there is any vomiting or loose motions or excessive crying, or you are seeing like excessive crying or vomiting, then you need to see, go slowly with the quantity. Okay, no need of any digestive enzymes. If the baby is fine, active, playful, and slowly, gradually come down the milk also, increase the semi-solid food. Okay, and when the baby is growing and he is developing new milestones like crawling and standing with support, then without support, the risk of fall will be always there. So take precautions to avoid the trauma when there is accidental fall. Okay, hope I have addressed the most common concerns in the neonatal and infantile period. Thank you. Any concerns are there, or you have any other issues, please reach out to Apollo Cradle. Okay, thank you.